everybody. I'm waking up super ultra rough. Ugh. Mornings and I don't get along like we used to. Just a quick pop on, another health update. I just got a call from rheumatology about my issues, about my blood tests, and RA is now no longer a maybe. It's a yes. It's a yes. Chronic fatigue, fibromyalgia are still there. My genetic disorders and immune issues and other things are still there. But RA, I honestly thought, because my score was so low, and yes, I'm in copious amounts of pain, often. I just assumed, because it's just getting older, you know, and it's a lot of muscle pain, at least it feels like it. I'm so disoriented in the morning, and so weak and confused that I don't know where the pain is. I just know that I'm hurting, and I'm stiff and I hurt. And so I attributed that to fibromyalgia. I'm sure some of it is the fibromyalgia, but I honestly didn't think I had RA. I know there's more going on than chronic fatigue syndrome, and fibromyalgia, and RA. That they have not got to the bottom in HHT, and they haven't got to the bottom of. But I got a wake-up call from rheumatology to speak with me during cancellation telehealth visit about my test results. They have jumped dramatically in my inflammation in my RA test from when they first saw me, so it's no longer a question, it's a confirmation. And I will be starting a medication soonish. It'll take about 2 weeks for insurance to approve it, and about 3 months before I notice the difference, before it begins to build up in my system enough to make a difference. And it is an injection. My dad was a diabetic, so I'm used to seeing syringes and medications around and keep it in the fridge and all that other stuff. I'm not used to giving myself, and I'm not a wuss when it comes to getting a shot or getting an IV. I just don't pay attention, and it's good. I've never had to give myself injections, and it'll be an every other week injection medication. So, that'll be fun. But, and it'll take a while for it to pay dividends. But at least we're picking up more and more pieces of the puzzle, and there's still some things for my lab results that I need to consult my primary physician about, and figure out why I'm not clearing things out of my system like I'm supposed to. But yeah, find little breadcrumbs. Little breadcrumbs. And honestly, this one took me by surprise. I've had RA up there for a while because it was brought up as a potential, and I had a few minor symptoms, but when I first went in, I had a genetic disorder, I had an overactive immune system, I had a L-carnitine deficiency, I had iron deficiency anemia, and a few other things going on, and that was where they were focusing my medications, my recovery, and protein deficiencies and things, as to correct all the deficiencies, and mitochondrial issues and genetic disorder, and reinfuse me with iron and get my L-carnitine levels and DHA and everything up to where it should be. And I felt about 30% better, and then I just stopped. And in the last couple weeks, I've been so... it's been hard. It's been real hard the last couple weeks, physically. And I've just been so exhausted 24/7. And maybe that's why. So, yeah, RA is no longer a question part of the puzzle. It is not the answer to the puzzle, although fatigue is an RA symptom, is fatigue and a general sense of feeling ill along with the pain, because it is an autoimmune condition, but not to the degree of chronic fatigue syndrome, not to the degree of the fatigue that I experience. But it is a piece of the puzzle, so we're getting there. Little breadcrumbs and lots of patience. So my morning is discombobulated. I am thrown off completely because I'm always thrown off in the morning. Morning is hard for me. And I've been at my boyfriend's for a while, and I have a very busy week. I have some more testing at U of M in this weekend, and I have to get a pre-test, COVID test, because I'm going to be using breathing equipment and having my mouth where everybody else has their mouth. And so just to be extra safe, even though I've been vaccinated, they require COVID tests. We're going to do that. And then the next week, I go and get my psych meds and see my therapist and get my once a month injection for my antipsychotic. And my mother, who I rarely ever see, is going to visit. Maybe I can talk her into coming on here, and you can meet my mama. Maybe, we'll see. I just pretty much popped on here to tell you we're breaking ground. I don't care at this point I do care what they find. I don't want them to find something that's terminal or devastating me any more incurable than what I already have. But any little snippet of something that they can find, that they can treat, offers me a slight chance of improving my situation. So, yeah, I most definitely have RA. Not happy that I have RA. Happy that they found another thing to be treated. Every negative lab test is a double-edged sword, or positive lab test, depending on what they're looking for, is a double-edged sword. A piece of me is grateful that they have a thread to follow, something to look toward, to try to figure out treatment. That I can work toward treating myself, and they can work toward treating me, rather than just having everything come back normal and being like, I still feel miserable, exhausted, in pain, and like I have the flu and a hangover every day. I'm dragging my way through life, and feeling so ill and having everything come back normal is such a frustrating, difficult, and lengthy process. And eventually, over time, little things will pop up, and every little thing that pops up offers a new opportunity for a little bit of improvement. Like I said, I don't think RA is great. I'm not glad to have it. Yay! I'm glad it's definitive, something to be treated that might make me feel a little bit better, because it will take away some of the pain once all the medication starts doing its thing. Eventually, I'm looking at a 4 to 5 month window for that, and having to inject myself every day, which I'm not looking forward to. Not every day, but once every other week. And it's a progressive issue, and it does come with chronic fatigue and a general feeling of malaise. So even although I still have CFS and CFS-ME and fibro, taking away some of that inflammation, overall body inflammation, and what my immune system is trying to fight, and getting the RA under control will take away some of the pain, will take away some of the fatigue, will take away some of the feeling of illness. And maybe, like when I started, I was 100% shit, and then they plugged all the nutritional deficiencies, genetic disorder supplementation, iron deficiency, anemia, and I went up about 30% and just kind of stayed dead in the water there. And lately I've been sliding back, perhaps having something to treating it with patients for the medication and things to work will take the edge off and bring me up another 20, 15, 20, 30% improvement. And anything that offers improvement, I'll take that. And I'll be following up with my doctor, my primary, about a few other results that they didn't really get into that I'm not gonna let drop. You gotta be like a dog with its favorite chew toy that when he brings it up to you, it just won't let it out of its mouth. If you see any abnormal result, anything high, anything low on your labs, and you have medical mysteries occurring, be a dog with their favorite chew toy, do not let that shit drop. Follow it up, chase it down. You have to be your own advocate. So yeah, RA is no longer a maybe. I have RA. But it's something else to treat. I just thought I would update that on my health section. Keep you all in the loop. And because I didn't know what else to do with myself, because my morning was spent on the telephone, half asleep. And I gotta do some life stuff, which I don't know what that is, because I'm half asleep, and probably take a couple more bareback and bodies. Now I'm just yammering. So I'm going to show you my kitty, because she's cute. Don't mind my clothes, I need to clean my apartment. Oh, look at that. Did you get cuter just because you knew you were being filmed? Yes, you did. You're just, oh, she's purring. You're the sweetest little cat. I love you so much. Goodbye. Good day. Good cat. I wish you all health, wealth, and wisdom, and enough time to appreciate them. Peace. I gotta go hop in the shower and do some adult things before I gotta go to my job. Really. I gotta pull my head out of my, get doing stuff and things.